MacBook, we here. What is going on? We're going to get started here in about 2 minutes. 2 minutes. We're going to get started with muscles of the lower limb, starting with muscles in the hip region. Muscles in the hip region. And then, of course, if you have any questions, uh, chime in. Chime in the chat. I'll stop. We can review origins, insertions, actions, innervations. I think there's an exam coming up uh, next week. And so this is the perfect time to just review and practice those muscles of the lower limb, cranial nerves and foramina, things like that. Some of you may be taking a microbiology exam uh, around this time. I can also go over the complement system and adaptive immunity, microbial mechanisms of, sorry about that, pathogenicity. We can cover some of those things. Principles of disease and epidemiology. These big words are killing me at 8:30 in the morning. Coming up, muscles of the lower limb in about a minute. Gluteus maximus. And so we're going to talk origin, insertion, action, innervation for the gluteus maximus. Alrighty? So, what is the origin of the gluteus maximus? That's right. We can say sacrum, ilium, right? And what about its insertion? That's right. The gluteus maximus is going to insert. You see a little bit of here on the IT band, but also the gluteal tuberosity. And let's just take a closer look at that. And so we see the gluteus maximus originating there on the, that's right, sacrum here, and the ilium here. We can also see some origin here on the coccyx. And then our insertion for the gluteus maximus, where we see it inserting here on the, that's right, the femur bone. But it's also going to insert on the IT band, or even the tensor fascia lata. Okay? Gluteus maximus. What about the action? What's the action for the gluteus maximus? What does it do? You see how it's extending that hip. Here's our gluteus maximus. Powerful extender of the hip. Okay? Innervation. Innervation for the gluteus maximus. Inferior gluteal nerve. You see it there highlighted, and it's coming off of that sacral plexus. Okay, so we went over origin, sacrum, ilium, insertion, IT band, gluteal tuberosity of the femur. Action, powerful extender of the hip. Innervation, inferior gluteal nerve for our gluteus maximus. Okay, so our next muscle we're going to talk about is the gluteus medius. Gluteus medius just lies deep to the gluteus maximus. You see it here. And so what I'm going to do is go ahead and reflect this gluteus maximus. And we have our gluteus medius here. Gluteus medius. If you look right below that muscle, right, just deep to that muscle, you have the gluteus minimus. Okay, so let's talk about the gluteus medius: origin, insertion, action, innervation. Gluteus medius. So what's the origin for the gluteus medius? That's right, the gluteus medius originates on the dorsum of the ilium and the iliac crest. You can see it there. Here's our ilium. You can see it originating there. Okay, and the insertion for the gluteus medius is going to be where? That's right, the greater trochanter of the femur. You see that there? There's our insertion for the gluteus medius. What about the action? Action for the gluteus medius. And we can see it acting here. Abduction. Abduction of the hip, stabilization of pelvis when in motion. Gluteus medius. Innervation. Innervation for the gluteus medius. That's right, superior gluteal nerve. It's a branch of the sacral plexus. And you can see that nerve going through there to innervate that muscle. Gluteus medius. Let's look at the gluteus minimus. All right, this muscle here. Gluteus minimus. Origin, insertion, action, innervation for the gluteus minimus. What is the origin for the gluteus minimus? You can see where it originates there on the, that's right, gluteus minimus originates on the dorsum of the ilium. What's the insertion for the gluteus minimus? Insertion. That's right. That's right. Greater trochanter, right, of the femur. Here's our femur bone here, and we can see that gluteus minimus inserting there on that bone right there. Isn't that beautiful? Gluteus minimus. Action. Action for the gluteus minimus. Action for the gluteus minimus. That's right. Abduct, right? Abduction of the hip joint. What about innervation? Superior gluteal nerve. It's a branch of the sacral plexus. Tensor fascia lata, and we'll talk about this one here. Origin. Origin for the tensor fascia lata. That's right. Right there. Right there, you see it on the iliac crest. Right here, here's the ilium. And you can see it originated right there on the crest of the ilium. What about the insertion for the tensor fascia lata? What does the tensor fascia lata insert? That's right, it's going to insert on the iliotibial tract, right? The IT band, or the iliotibial tract. You can see them articulating here. Here's the tensor fascia lata. Here's the IT. So our origin, iliac crest of the ilium. And then the insertion for the tensor fascia lata is going to be the IT band. The IT band here. And the IT band is going to originate on the tensor fascia lata. And it's going to insert on the tibia, way down here. Tibia in the leg, right? Here's the IT band, and you can see its insertion down here on the tibia. Okay? What about action? What's our action for the IT band? It's going to control those quads. Okay? IT band. What about innervation? Innervation for the IT band. That's right, it's innervated by the superior gluteal nerve. Superior gluteal nerve for the IT band. So again, tensor fascia lata runs right into the IT band. IT band originates on the tensor fascia lata and then inserts down here on the tibia. IT band, iliotibial band of fascia. Okay, IT band. Okay, one more muscle we want to cover in this region, in the region of the hip, is the piriformis. What nerve is this? That's right, sciatic nerve. So that's your piriformis. The piriformis is one of the major causes of sciatica. Here's the muscle here, piriformis, right? And that muscle can get hard, swollen, and it'll actually put pressure on this nerve here, pushing it into the bone, okay? So remember that when you think piriformis, sciatica. Origin, we said what? Originating on the anterior sacrum. So if we turn the sacrum around, here's our sacrum, right? From last unit. And we can see piriformis right there on that ventral surface of the sacrum, running through that greater sciatic notch there. And then where's it going to insert? Where's the piriformis going to insert? That's right, the greater trochanter, right? Right here on the greater trochanter. You see it, we see it there. Greater trochanter, piriformis. That's our piriformis at work. So again, origin, anterior sacrum, or sacrum, anterior surface, we see it there. Insertion, remember it's going to pass through the sciatic notch of this os coxa, you can see it there, and it's going to insert on the greater trochanter of the femur. That's our innervation for the piriformis muscle. So what we have done is we've gone through the major muscles in the hip region. And it's really amazing because if you look at this, we've covered 1, gluteus maximus, 2, let's remove this so we can really see it, gluteus medius, that's right. And just deep to this gluteus medius, I'll go on this one over here. We have, what's that muscle there? Just deep to that gluteus medius. That's right, this muscle right here. Gluteus minimus, good, gluteus minimus. And we see inferior to that, these muscles here. That's right, running over that sciatic nerve. Piriformis, good, piriformis. We have this muscle here. That's right, tensor fascia lata, good. That tensor fascia lata runs right into this band of fascia here. What do we call this? That's right, the IT band, the iliotibial tract band of fascia inserting on the leg down here in the tibia. I know this is a review, but make sure you go over it over and over again. Make sure you know your origin, insertion, action, innervation. What is going on? We're going to get into muscles of the medial thigh, muscles of the medial thigh next. Let's kick that off now. We can get that going right now. Muscles of the medial thigh. Muscles of the medial thigh. Muscles of the medial thigh. Let's start with this muscle. Let's start with this muscle here. That's right, the gracilis. The gracilis. Let's talk origin, insertion, action, innervation real quick. What is the origin of the gracilis? That's right. os coxa, right? Superior ramus of the os coxa. What about the insertion? The insertion for the gracilis muscle. That's right. Medial anterior tibia. Medial anterior tibia. What about action? Action for the gracilis muscle. That's right. Adductor of the thigh and a weak knee flexor. Okay, now we're going to talk adductor brevis. Adductor brevis, you see it highlighted there. And just to give you some reference, here is adductor magnus highlighted. Here's pectineus. And so if you peek through those two, you can see adductor brevis. Let's talk origin, insertion, action, innervation for adductor brevis. That's right, adductor brevis, adductor longus, and then just deep to that, adductor brevis. And so just deep to the longus would be the brevis right here. So now we can see it like that. Okay, adductor brevis. Okay, origin for the adductor brevis and the adductor longus would be, yeah, pubic ramus. Insertion for the adductor brevis and adductor longus, linea aspera, right? Linea aspera. And then what about action? Action for these muscles, adductor brevis and adductor longus. That's right, adduct the hip, right? Longus, brevis, adduct the hip. Innervation. That's right, obturator nerve. Obturator nerve. Again, highlighted right now is the adductor brevis. On the left side, patient's left, you can see the adductor brevis highlighted. The adductor longus has been removed. Okay. On the patient's right side, your left, you can see the adductor brevis highlighted just deep to the adductor longus. Okay, let's talk about this muscle here, adductor magnus, and let's talk origin, insertion, action, innervation of this muscle. You can see it's a large muscle. Origin for the adductor magnus. That's right. It originates inferior ramus of the os coxa and the ischial tuberosity of the ischium. What about insertion? Insertion for the adductor magnus. That's right, linea aspera of the femur, but it also inserts at the adductor tubercle, the distal aspect of the femur. Adductor tubercle, you can see it peeking through there. Adductor magnus. What is the action for the adductor magnus? That's right, powerful adductor of the thigh. Innervation for the adductor magnus. That's right, obturator nerve and also tibial nerve. So two nerves for the adductor magnus. So that pretty much sums up our muscles of the medial thigh. We've talked about the adductor magnus, the gracilis muscle, we've also talked about adductor brevis, and abductor longus. Muscles of the medial thigh. Continue to practice and review those. muscles of the medial thigh. Hopefully that was helpful. When we come back, we're going to get into muscles of the, that's right, anterior thigh, origin, insertion, action, innervation, in about 5 minutes. Muscles of the anterior thigh. Muscles of the anterior thigh. Of course, we're talking biceps femoris, vastus lateralis, vastus intermedius, vastus medialis, and the beautiful sartorius muscle. Let's get into it. Muscles of the anterior thigh, right here, right here. And for clarity, we're talking these muscles here. Rectus, that's right, rectus femoris, vastus lateralis, vastus medialis, sartorius, and then, just deep to that rectus femoris, you have the vastus intermedius. So let's begin with, so here's our rectus femoris here. And let's talk origin, insertion. I just want to say real quick, during my introduction of these muscles of the anterior thigh, I know I said biceps femoris, and as you know, I'm sure you caught it because this is a review. Biceps femoris is a muscle of the posterior thigh. So our muscles of the anterior thigh are, of course, vastus lateralis, vastus intermedius, right? Vastus medialis, and then the rectus femoris. Okay, so let's continue. I just wanted to clarify because I don't want to confuse anybody for the exam. Let's go here, and let's talk origin, insertion, action, innervation. Okay, so what is the origin? That's right, the rectus femoris originates on the ilium, anterior inferior iliac spine. You see it there. What does the rectus femoris insert? That's right, it inserts on the tibial tuberosity. Rectus femoris. Okay. What about action? What does it do? That's right, extends the leg, flexes the hip. Innervation. Innervation for the rectus femoris. That's right, femoral nerve. Femoral nerve for the rectus femoris. Okay, what about vastus lateralis? The vastus lateralis. Vastus lateralis. Origin, insertion, action, innervation for the vastus lateralis. What's our origin for the vastus lateralis? That's right. That's right. Greater trochanter, right? Greater trochanter of the femur, linea aspera. Okay. What about insertion? Tibial tuberosity. Tibial tuberosity. Tibial tuberosity. Okay. Action. Action for the vastus lateralis. Action. Extends the leg. Good. Extends the leg. And what about our innervation? Innervation for the vastus lateralis. Yes, femoral nerve. Femoral nerve. Okay, let's talk about vastus medialis. Vastus medialis. Can you identify that muscle? Vastus medialis. Vastus medialis, that's right. Right here. Vastus medialis. Vastus medialis. Origin, insertion, action, innervation. Let's go. Origin for vastus medialis. Origin. Yeah, intertrochanteric line. Intertrochanteric line on the femur. Also, where else? Where else on the femur? That's right, linea aspera. Good. What about insertion? Insertion for the vastus medialis. That's right. Tibial tuberosity. We could say tibial tuberosity via the patella. How about vastus intermedius? That muscle, remember, is going to be deep to the rectus femoris. Vastus intermedius. See, it's just deep to the rectus femoris. And I've on the left side, well, your left, you can see the rectus femoris is faded, and deep to it, you can see the vastus intermedius. Okay, so now we're going to go ahead and dissect this rectus femoris. Okay, and now we have the vastus intermedius. Origin for the vastus intermedius. Origin, that's right. Vastus intermedius originates on the femur, proximal. Vastus intermedius originates on the femur. Insertion Insertion for the vastus intermedius. That's right. Tibial tuberosity via the patella. You can see it there. For the vastus intermedius. Action. What's the action for the vastus intermedius? That's right. Extends the leg, right? It acts to extend the leg. Okay. Innervation. Innervation for the vastus intermedius. Yeah, that's right. Femoral nerve. Good. Femoral nerve. Vastus intermedius. Vastus intermedius. Okay. Vastus medialis and vastus lateralis. Right. Those are the three vastus muscles. Okay, let's talk about the sartorius. It's also a muscle of the anterior thigh. Can you locate it? Can you identify it? Origin, insertion, action, innervation. This muscle right here. What's the origin? What's the origin for the sartorius? The anterior superior iliac spine. What about insertion? Insertion for the sartorius. Medial condyle of the tibia. Medial condyle of the tibia. Action. What's the action for the sartorius? That's right. Flex hip, right? It can flex the hip. It can also do what? Flex the knee. Yes, it can flex the knee. Yeah, that's right. A lateral rotator of the hip. Innervation. Innervation for the sartorius muscle. That's right. Femoral nerve. Femoral nerve. Make sure you continue to review, practice rectus femoris, vastus lateralis, vastus intermedius, vastus medialis, and the sartorius. Review, practice origin, insertion, action, innervation. Okay, let's get into muscles. Muscles of the posterior. Muscles of the posterior thigh. Coming up next, muscles of the posterior thigh. Of course, we're talking about biceps femoris, semitendinosus, semimembranosus. That's right. Good. Let's get into that. Coming up in about 2 minutes. Muscles. Muscles of the posterior thigh. Muscles of the posterior thigh coming up. Biceps femoris. Semitendinosus, semimembranosus. Let's do it. Let's get into it. Muscles of the posterior thigh. Origin, insertion, action, innervation. I like that. Origin, insertion, action, innervation. Let's get it. Muscles of the posterior thigh. What is going on? This is Anatomy Review and Practice. I'm Mac, and we're going to go over the muscles in the posterior thigh. We're going to start with this muscle here. This is review, so you should be able to recall this. That's right, biceps femoris. We're going to talk about the, semitendinosus, and then, semimembranosus. Okay? Origin, insertion, action, innervation of these muscles. Can you give me origin, insertion, action, innervation for the biceps femoris? Let's start with the long head. The long head of the biceps femoris originates ischiotuberosity. Good. Ischiotuberosity, and it inserts fibular head, right? The head of the fibula. Good. Okay. Here. That's the short head of the biceps femoris. Origin. That's right. Short head originates on the linea aspera. Here's the femur. And then here's our short head. Okay, linea aspera, insertion. Insertion for the short head. That's right, it inserts together with the long head on the fibular head. Right there in the fibula. Innervation for the biceps femoris. Long head. That's right, the long head is going to be innervated by the tibial nerve. And the short head here of the biceps femoris. Innervation. Common fibular nerve. Good. Common fibular nerve. Okay. All right. Action. What's the action for the biceps femoris? What does it do? Extends the hip. Good. Lateral rotation of the knee. Lateral rotation of the knee. Good. Biceps femoris. Okay, let's talk about this next one here. The semitendinosus, right? Semitendinosus. What's the origin? What's the origin for the semitendinosus? That's right, it originates, ischiotuberosity. Okay, what about insertion for the semitendinosus? Insertion, what does it insert? Semitendinosus, that's right. Medial anterior tibia, right? Medial anterior tibia. Semitendinosus insertion. Medial anterior tibia. There's a tibia bone here. Semitendinosus. Okay, what about action? What's the action for the semitendinosus? What does it do? Semitendinosus. That's right. Extends the hip. Flexes the knee. What's the innervation for the semitendinosus? That's right. Tibial nerve. Tibial nerve. Tibial nerve. Good. Let's keep moving. Let's keep moving. How about semimembranosus? Can you identify the semimembranosus? Semimembranosus. Semimembranosus. That's right. This muscle here. There we go. Here it is on the right. Here it is on the left. Semimembranosus. And what is our origin for the semimembranosus? That's right. Ischiotuberosity. That's right. Ischiotuberosity for the semimembranosus. Let's go ahead and reflect this semitendinosus so we can see that, semimembranosus. Insertion. Insertion for the semimembranosus. That's right. The anterior superior tibial medial condyle. You see it there. Here's the tibia. anterior, superior, medial, condyle, semimembranosus, tibia. Okay, insertion. What about action? Action for the semimembranosus. What's the action for the semimembranosus? That's right. Extension of the hip, flexion of the knee, extension of the hip, flexion of the knee, medial rotation of the knee. Innervation. That's right. Tibial nerve. So we've talked about these muscles in the posterior compartment. We talked about biceps femoris, both heads, right? Long head, short head, biceps femoris. We talked about this muscle here. That's right, semitendinosus. And then the muscle just deep to it, semimembranosus. Good. We talked origin, insertion, action, innervation of these muscles. And we just keep on reviewing them until we know them. Biceps femoris, origin and insertion. That's right, ischiotuberosity. Inserts, both heads insert on the fibular head, right? So the head of the fibula. Short head of the biceps femoris originates, linea aspera, good. And that's right, it's going to insert with that long head on the fibula. And then, you know it. That's right, semitendinosus, and semitendinosus originates, right, ischiotuberosity, inserts, medial anterior tibia, good, action, extends hip, flexes the knee, innervation, that's right, tibial nerve, semitendinosus. What about this muscle here? Just deep to that semitendinosus, yes, semimembranosus, origin, that's right, ischiotuberosity, insertion, that's right, anterior, superior, tibial, medial condyle, okay, action, semimembranosus, extension of the hip, flexion of the knee, medial rotation of the knee, and then our innervation, of course, is going to be the tibial nerve. Hey, that's the muscles of the posterior thigh, biceps femoris, semitendinosus, semimembranosus. When we come back, we're going to talk about the muscle. What is going on? When we come back, sorry about that. When we come back, we're going to talk about, that's right, cranial foramina, nerves, cranial nerves and foramina, however you want to say it. We're going to get into them when we come back in about 3 to 5 minutes. 3 to 5 minutes. Of course, if you're tuning in right now, you can always chime in, ask a question. I'm here. I'm here to help you review and practice for this next anatomy exam. I know some of you had micro exams, and I had a wonderful time reviewing and practicing with you for those microbiology exams. I know you did well. And I'm looking forward to hearing about it. But right now, at this time, we're going to get into cranial foramina and nerves right here. Let's go. Let's start at the olfactory foramina. Can you identify it? That's right. If we zoom in here, right? Olfactory foramina. And the olfactory foramina is for what cranial nerve? What cranial nerve? That's right. Cranial nerve number 1. Cranial nerve number 1, the olfactory nerve, passes through the olfactory foramina. Good. This is just a review. This is just practice, review. Okay, how about the optic canal? The optic canal. Can you identify the optic canal? Optic canal. That's right. Optic canals are located here. And what cranial nerve goes through the optic canals? That's right, cranial nerve number 2. Cranial nerve number 2. What's the name of cranial nerve number 2? Optic nerve. Right, optic nerve. Go through the optic canals. Cranial nerve number 2. Okay, how about the superior orbital fissure? Superior orbital fissure. Can you identify that? The superior orbital fissure. Superior orbital fissure. Superior orbital fissure. Superior orbital fissure. What cranial nerve will pass through the superior orbital fissure? What cranial nerves? Superior orbital fissure. That's right, cranial nerve number 3, 4, 5, 1, right? And 6. So cranial nerve number 3, 4, 5, 1, and 6. So 3 is what? What's the name of cranial nerve number 3? That's right, oculomotor nerve, right? Oculomotor nerve. What about cranial nerve number 4? What's the name of cranial nerve number 4? That's right, trochlear nerve. Trochlear nerve, cranial nerve number 4 passes through the superior orbital fissure. What about cranial nerve number 5, the first branch? That's right, ophthalmic branch, right, of cranial nerve number 5. Cranial nerve number 3, 4, 5, 1, and 6 pass through the superior orbital fissure. Number 6, that's right, abducens, right? Abducens nerve. Abducens. Cranial nerve number 6. So we have oculomotor nerve, trochlear nerve, trigeminal nerve, the ophthalmic branch, and the abducens nerve, okay? All passing through the superior orbital fissure. How about here? What foramen are these? That's right, foramen rotundum, right? Foramen rotundum. What cranial nerve passes through foramen rotundum? That's right, the maxillary branch of cranial nerve number 5. So 5-2, the maxillary branch of cranial nerve number 5 passes through the foramen rotundum. Okay, how about these? These highlighted here. That's right, foramen ovale for, that's right, the mandibular branch of cranial nerve number 5. So 5-3, the mandibular branch of cranial nerve number 5 passes through foramen ovale. How about here? How about these holes here? That's right, internal auditory meatus, right? Internal auditory meatus. Cranial nerves number, that's right, cranial nerve number 7 and 8 both pass through this internal auditory meatus, right? So cranial nerve number 7, what's the name? What do we call that nerve? That's right, facial nerve. Facial nerve. Cranial nerve number 7 passes through the internal auditory meatus. And then cranial nerve number 8, what's the name of that nerve? And there's a few, so that's right, vestibular cochlear nerve for cranial nerve number 8, or auditory nerve, or acoustic nerve. Okay, so you can have vestibular cochlear for cranial nerve number 8, or auditory for cranial nerve number 8, or acoustic for cranial nerve number 8. Okay, but Cranial nerve number 7 and 8 both pass through the internal auditory meatus. How about here? Right down in here, I'll zoom in on the right side. This foramen here. Jugular foramen. Jugular foramen. Okay? Jugular foramen. What cranial nerves pass through the jugular foramen? Yes, cranial nerve number 9, number 10, and number 11. Those cranial nerves all pass through the jugular foramen. Cranial nerve number 9, 10, 11. What's the names for those nerves? What's the name for cranial nerve number 9? Cranial nerve number 9 we call glossopharyngeal nerve. Good. Glossopharyngeal. Good. What about cranial nerve number 10? What's the name for cranial nerve number 10? That's right. Vagus, right? Vagus nerve. Cranial nerve number 10. Vagus. Cranial nerve number 10. What about cranial nerve number 11? What's the name for cranial nerve number 11? That's right, accessory nerve. Accessory nerve. Cranial nerve number 11 passes through the jugular foramen. Accessory nerve. So again, 3 nerves passing through the jugular foramen. Cranial nerve number 9, glossopharyngeal nerve, cranial nerve number 10, the vagus nerve, and cranial nerve number 11, the accessory nerve. Those 3 nerves pass through the jugular foramen. How about here? Now zoom out and zoom back in. That's right. Hypoglossal canal, right? Good. All right, hypoglossal canal is for cranial nerve number 12. Good. Cranial nerve number 12. And what's the name of that nerve? Yeah, hypoglossal nerve, right? Hypoglossal nerve. All right. So that was a review. Bones. Well, we didn't do bones, but we did. That's right. Cranial nerves and foramina. And we talked about those little holes in the skull and the nerves that go through them. 12 cranial nerves. Next, we're going to get into bones. Bones of the lower limb. Uh, and bony landmarks. And so let's get into that. Let's just jump into it. Bones of the lower limb. Need a break? Okay, we'll take 5. We'll take 5. And when we come back, we'll get into bones of the lower limb right here. What is going on? This is Anatomy Review and Practice, Virtual Cadaver Lab. I'm Mac, and I'm here to just kind of guide you through some review, some practice of the muscles of the lower limb. We'll hit up the hip region, posterior thigh, anterior thigh. We'll also get into the legs. But right now, what we're going to do is review these bones of the lower extremity. So we'll start with the os coxa. Here you see os coxa on your screen. You should be able to identify this. And we'll just go through the bony landmarks of the os coxa. You know, os means bone, coxa means hip. So here you have your hip bones. And we'll go through these landmarks together. Okay, so right up here at the top, you see right here, what is this landmark here? And this is a review, this is practice, that's right, iliac crest, the iliac crest, right there. We have a lot of muscles that will articulate with that iliac crest, you see there. Okay, let's keep moving, Our next landmark, right here, yeah, what is that? That's right, anterior superior iliac spine. Anterior superior iliac spine. Good. Anterior superior iliac spine. What about right here? This landmark here. You see it here. That's right. The anterior inferior iliac spine. Anterior inferior iliac spine. And you know there are muscles that will articulate with that landmark as well. Let's keep moving. How about here? This hole here, this space. What do we call this? That's right. Obturator foramen. Good. Obturator foramen. Let's keep moving. How about here? This landmark here. Yeah, right here. There's a little opening here. That's right. Acetabulum, right? Or acetabellum, depending on your professor. But that little opening there, that hole there. Yeah. Acetabulum or acetabellum. Okay, let's keep moving. How about here? That's right, iliac fossa. I kind of gave you that one. But the iliac fossa. Yeah, that's a landmark. You're going to want to know. Iliac fossa. Okay, let's keep moving. Let's break this bone. You know, it's two os coxa come together to form the pelvic girdle, right? So you have the two os coxa, and then you have the sacrum, right? That sacrum there, and those form the pelvic girdle. Let's take a look at one os coxa, right? One os coxa, which of course are three fused bones, right? So if we look at this here, here's our os coxa here, these three fused bones. You can see how they come together in the acetabulum. But this bone here, that would be your, that's right, ischium. That's right. Pubis. Right. So this is ilium, right? Ilium. I think I said ischium. Ilium. Pubis. Right? Pubis. And then here, that's right, ischium. There's your ischium. You have that ischiotuberosity. Okay? So again, ilium. Same on both sides. Ilium. Pubis. Ischium. Okay? I like looking at it this way because you can see where they come together right there in the acetabulum. Ilium, ischium pubis. Okay. So if we have this, if we take this view here, dorsal or external surface on the left, pelvic surface on the right, we can now label some of these bony landmarks. So if we're this bony landmark here on the dorsal surface, that's right, posterior gluteal line, right? The posterior gluteal line. And then here, that's right, anterior gluteal line. Anterior gluteal line. Das coxa. And how about here? Yes, inferior gluteal line. Good. Inferior gluteal line. Let's keep moving. How about here? We covered this one already. This is a review. That's right, acetabulum. And here, this hole here. We've also reviewed this today already. That's right, obturator foramen. Obturator foramen. How about here? This point right down here on the ischium. That's right, ischial tuberosity. Ischial tuberosity. Good. Let's keep moving. How about here? This point here. On that pubis bone. Yeah, that's right. That's the pubic. That's right. Pubic symphysis surface. Surface of the pubic symphysis. Let's see. Surface of the pubic symphysis. Okay. How about here? You see that little arrow there? Flashing. That's right. Lesser, right? Lesser sciatic notch. Lesser sciatic notch. How about here? Yes, iliac ischial spine. Ischial spine. How about here? You know this one. That piriformis muscle passes through here. That's right. Greater sciatic notch. Greater sciatic notch. And here, the surface area here. What do we call that? The surface area. That's right. Articular surface, right? That's where it articulates with the. That's right. Sacrum. Yes. Sacrum. And then, of course, we have that. This is the iliac fossa. The iliac fossa. This is that anterior surface. All right, let's keep moving. Let's take a look at pelvic sexual characteristics. Pelvic sexual characteristics. Let's take a look at that. You see female on the left, male on the right. But the female, right? So let's, subpubic angle, 80 or more. Ischial spine far apart for the female, closer together for the male. Pelvic brim. That's right. Oval shaped for the female, rounded for the male. So we said subpubic angle 80 or more degrees on a female and less than 80 degrees on a male. Ischial spine, the ischial spine far apart. Ischial spines are far apart on the female. Ischial spines are close together on the male. Pelvic brim, we said oval shaped on the female. Pelvic brim is rounded on the male. And then when we're talking about these coccygeal vertebrae, you're going to have 3 to 4 on the female, while you'll have 4 to 5 on a male. And then, yeah, the pelvic outlet. The pelvic outlet is rounder for a female. And it's going to be slightly oval shaped for a male. Okay. All right, let's move in and talk about this bone here, the femur bone. Okay. And if we look at this, we have some bony landmarks on here we're going to want to identify. Here, this landmark right here. That's right, the head of the femur, right? The head of the femur, good. Head of the femur, and then if we look here, this landmark here, yes, fovea capitis, one of my favorite, fovea capitis. How about here? Yes, the neck, right? That's the neck of the femur, good. It's the neck of the femur. All right, we're moving. How about here? Yes, greater trochanter, right? Greater trochanter, good. Greater trochanter. What about here? This landmark here. That's right. Intertrochanteric line. How about here? This point here. That's right. Lesser trochanter, right? Lesser trochanter. And here, medial epicondyle down here to give us some reference of where we are. Distal. And then this landmark here. What do we call this? That's right. Abductor tubercle, right? Abductor tubercle. Those medial muscles of the thigh. Abductor magnus. Let's keep going. Down here. This landmark here. Yes. Patellofemoral surface. That patella bone will articulate with that. How about here? Over here on the lateral side of this bone. Yes, lateral epicondyle. And yes, this is an anterior view of the femur. Let's take a posterior view of the same bone. So this is the posterior surface of our femur bone. Posterior surface. Let's come on. This is a review. So some of these landmarks are the same ones we just covered. But that's okay. Up here. That's right. The head of the femur. The head of the femur. How about here? Yes. Lesser, right? Lesser trochanter. And in here. In this region here. Yes. Abductor tubercle. What about here? This line going down the posterior surface of this bone. Yeah, that's right. Linea aspera. Good. Okay. How about here? This landmark right here. Yeah. Gluteal tuberosity. Good. Gluteal tuberosity. Okay. In here. That's right. Greater trochanter. Right? Greater trochanter. Here. What about here? This is a review. You know this. That's right. The neck. The neck of the femur. And of course, this is a posterior view of the femur. You may want to know these landmarks. Always check your notes. Always check with your professor. But these are some of the basic landmarks of this bone. Several muscles articulate with these landmarks. So you'll definitely hear these when you're reviewing origins, insertions. Next bone. This bone here. Yeah. I have it highlighted in blue on the right. Yeah, what bone is this? That's right. Patella. Good. Patella. And you have one on both sides. There's one here. Patella. This is an anterior view of the patella. So let's cover tibia and fibula. You try it. Tibia and fibula. You see here, this are those two bones. And we're going to go over some bony landmarks on these two bones. Starting with this landmark here on the tibia. What is this? On the tibia. That's right. Intercondylar eminence. How about here? This landmark here. This surface landmark. Yeah. Medial condyle, right? Medial condyle of the tibia. Medial condyle of the tibia. How about here? This landmark here. One of my favorites. Maybe yours too. Yes, the tibial tuberosity. He's getting tongue-tied today. Tibial tuberosity. How about here? Yes, medial malleolus. Medial malleolus. Don't forget that. And here, yeah, tibial plafond, right? Tibial plafond. How about here? That's right, lateral epicondyle. Okay. Posterior view of the tibia and fibula. Some of these landmarks we're going to review that we've just reviewed, but hey, this is practice. So what's this landmark here? That's right. That's the lateral condyle of the tibia. Right? Lateral condyle of the tibia. How about this landmark here on the fibula? Yes, the head of the fibula. Right? That's the head of the fibula. Let's keep moving. Landmark down here, distal end of this fibula. Yes, lateral malleolus. Lateral malleolus. Good. Lateral malleolus. How about here? This landmark here. That's right. Medial malleolus. Medial malleolus. Good. Medial malleolus. Here. This line here. One of my favorite landmarks. Yeah, that's the soleal line. And here, up top of that tibia. Yep. Medial condyle. Medial condyle. And of course, this is a posterior view of the tibia and fibula. Let's move into the bones of the foot. Bones of the foot. We'll move into bones of the foot. Here they are here. And we have landmarks here. Yeah, distal. Distal what? Phalange, right? Distal phalange. What is this one? Middle. That's right. Middle phalange. And then finally we have this proximal phalanges. And you have those on digits 1 through 5. Of course, digit 1 only has 2 phalanges. You're going to have a proximal and a distal. But the other 4 digits will have proximal, middle, and distal. How about here? These bones here in this region. That's right. Metatarsals. Metatarsals. Good. Metatarsals. 1, 2, 3, 4, and 5 metatarsals of the foot. How about this region here? These bones in this region here. That's right. The tarsals. Those are the tarsals. Okay. How about this bone here? That's right. Talus. And then this bone back here. Yes. Calcaneus. Calcaneus. All right. And that's it. That's anatomy review and practice. That's all I have for you as far as the osteology. Of course, we can also get into more detail, but I wanted to give you a review. I wanted to just touch on it. A lot of these you'll see again on your exam, possibly. So definitely review. Next, we'll get into the muscles. So we've covered bones of the lower limb. We've covered muscles of the lower limb. We've talked about cranial nerves and their foramina. If you have any questions or a material that you would like to go over, please email me, or better yet, go to www.contracosta.edu/classes/tutoring. Or you can, if you're a CCC student, you can go online and through your Canvas, you can put an online tutoring. You can find a plethora of tutors there to help you. And as always, I'm available. Reach out. Let's get this. You can do this. Make sure you continue to review and practice muscle origin, insertion, action, innervation. Continue to go over cranial nerves and foramina, bones. You know, the bones of the skull. If there's anything else in particular that you'd like to cover, we can go over that too.